Ok. Bienvenidos a todos al lanzamiento de la
Everyone
herramienta
to
para
this
calcular y
launch
cuantificar
of the
las
tool for
desigualdades en
calculating
salud.
and
Este
quantifying health
trabajo
inequality
representa la
metrics. This
colaboración
works
técnica entre el
represents
Ministerio de
the
Salud de
technical
Perú,
collaboration
en
between the
particular el
Ministry of Health
CDC Perú
in Peru, in
y
particular the
la OPS.
CDC from Peru,
Lo
and
mejor
PAHO.
de esta herramienta es
The best
su
about
uso
this tool
práctico a
is
nivel
its
nacional.
practical use at
Se
national
está
level.
trabajando para ampliar su
We're
uso a
working to
varios
expand
países
its
y
use
los
to several
distinguidos
countries,
ponentes que nos
and the
acompañan hoy
distinguished
nos
panelists that
darán
are
más
here with us
detalles al
today
respecto
will
de
be
eso.
giving us more
Les
details about
invitamos
this. We
a
invite you
participar con
to
entusiasmo
participate with
y a
enthusiasm
familiarizarse con el
and to get
uso de la
familiarized
herramienta
with the
y
use of the
cómo se
tool
puede aplicar
and
en
how it
diversos
can be
entornos.
applied in
Tengan en
different
cuenta que
environments.
hay
Keep in
traducción
mind that there is
simultánea en
translation
español, inglés y portugués.
in
Puede
Spanish,
hacer
English,
clic
and
en
Portuguese.
el
You
icono
can
de
click
traducción
on the
en la
icon
parte
of
inferior del
interpretation
Zoom.
at the
Voy
bottom
a
of your
cambiar
Zoom screen.
a
I will be
inglés.
switching to
Primero
English.
voy a dar la mic.
First, I will
I'm going
be
to pass the mic for opening words to the Dr. Leonardo Rojas Mezarino, el viceministro de Salud Pública en el Ministerio de Salud en Perú, y luego la doctora Maureen Birmingham, representante OPS-OMS en Perú. Por favor, el doctor Leonardo Rojas Mazarino.
Muchas gracias. Muy buenos días o buenas
Thank you so
tardes
much. Good
a
morning
todos
or good
los
afternoon, everyone,
representantes de la OPS,
to
OMS,
all representatives of PAHO
funcionarios
and
del Ministerio de Salud,
WHO, and
colegas de los gobiernos
officials of the Ministry of
subnacionales,
Health and colleagues
equipos
of the
técnicos,
subnational governments,
académicos y
technical teams,
estratégicos.
academia, and
Reciban un
strategic
cordial
partners.
saludo a nombre del Ministerio de
Kind
Salud del
greetings
Perú,
on
en
behalf of the
especial de
Ministry
nuestro
of Health of
ministro,
Peru,
doctor José Napoleón
especially
Quiroz
of our
Avilés,
Minister, Dr.
que no
José
pudo
Napoleón Quiroz
participar
Aviles,
el día de
who
hoy por
wasn't
temas de
able to
agenda,
participate today
pero para
because of his
nosotros es un
schedule.
honor
But
participar
for
en esta
us, it's an
apertura de
honor to
este
participate in
webinario
this
de
opening of this
lanzamiento de
webinar
la calculadora de
for the launch of
desigualdades
the tool for
en
calculating
salud.
health
Esta
inequality metric.
herramienta marca un avance sustantivo en la
This
forma en que
tool,
generamos
it marks
evidencia
a
para la equidad
substantial
en
advance
salud
on the way in
a
which we
nivel
generate evidence
nacional
for
y regional.
health equality
La
regionally
evidencia es
and
clara,
nationally.
¿no? Los
Evidence is
promedios
clear.
nacionales
The
no son
national averages
suficientes
are
para
not
orientar
enough
políticas públicas
to guide
eficaces
public
y cumplir con los
policies that are
compromisos de la Agenda
efficient and
2030.
to meet with
Es
the
necesario
commitments of the 2030
identificar,
agenda. It's
medir,
necessary to
monitorear
identify
de
and
manera
measure and monitor
sistemática
in
las
a
brechas que
systematic way
afectan a
all the
los
gaps
distintos
that affect
territorios
the
y grupos
different
poblacionales
territories
que viven en nuestro
and
país.
population groups
Solo
in
así es
our
posible priorizar
country. And this is the only
intervenciones
way that we
y
can
asignar
prioritize
recursos con
interventions and
justicia
assign
y
resources
fortalecer
in a
la
way that is
rendición de
just
cuentas en
and
salud
strengthen
pública.
accountability in
En
public
este
health.
proceso, quiero
In this
destacar de manera
process,
especial
I
el
want to
liderazgo
highlight
técnico del Centro
especially the
Nacional
technical
de
leadership of the
Epidemiología, Prevención y
National
Control de
Center of
Enfermedades, el
Epidemiology
CDC
and
Perú,
Control of Diseases
que
of
ha
Peru
impulsado una visión moderna
that has
de la
driven a
epidemiología,
modern
no
vision of
solamente
epidemiology,
describiendo eventos de
not
salud,
just
sino
describing
produciendo
health events,
inteligencia
but also
sanitaria
producing
orientada a la acción.
healthcare intelligence
La
guided towards
calculadora de desigualdades
action.
en salud es un ejemplo
The
concreto
health
de este
inequality
enfoque.
calculator
Una
is a great
herramienta
example of
diseñada
this
desde el
focus. It's a
conocimiento de
tool that has
contexto
been
nacional
designed from the
y
knowledge of the
nuestros
national
sistemas de
context
información
and
con una
our
clara
information systems with a
orientación a la
clear
toma de decisión.
guidance towards
Este logro
decision
también es el
making.
resultado de una cooperación técnica
This is also the
sólida y
result of a
sostenida con
solid
la
and
OPS
sustained technical
OMS
cooperation
que ha
with PAHO and
permitido integrar
WHO that has
estándares
allowed
internacionales
integrating
en esta medición de
international
desigualdades
standards
con
into this
realidades
measurement of
distintas en el país.
inequalities with different realities in the country.
Desde el Viceministerio de Salud Pública
From the Vice Ministry of
reafirmamos
Public
nuestro
Health,
compromiso
we
por promover
reaffirm
un uso
our
efectivo
commitment to
en los
promote
procesos
an
de
effective
planificación,
use in
monitoreo
the
y evaluación de
planning,
políticas
monitoring,
sanitarias.
and assessment
Reducir
process
las
for healthcare
desigualdades
policies.
en salud
And
es un
reducing
desafío
inequalities in health
técnico,
is a
político
technical
y
challenge,
sobre todo
and it's
ético.
also political
Requiere
and
instituciones
ethical.
sólidas como el CDC Perú capaces de transformar
It requires
datos
solid
en
institutions like the
decisiones
CDC
y
Peru,
evidencia
able
en
to
acción.
transform data
Agradezco al
into
equipo del
actions
CDC-Perú, a
and
la
evidence in
OPS,
action. I thank the
OMS
team of
y a todos
CDC
los actores
Peru,
involucrados en
PAHO,
este
WHO,
esfuerzo.
and all the
Con
stakeholders involved in
iniciativas
this
como
effort
esta, el
with
Perú
initiatives like this
contribuye
in Peru
activamente a una región de
and
las Américas
contributing
más
actively to a
equitativa,
region of
donde
the
la información
Americas
de
that is
calidad
more
se convierte en
equitable,
una
where
herramienta
quality
para
information
garantizar el derecho
becomes
a
a
la salud.
tool to
Muchas
guarantee
gracias.
the right to health. Thank you so much.
Gracias, doctor. Por favor,
Thank you, doctor.
invite al Dr.
And
Maureen Birmingham.
now we want to invite Dr. Maureen Birmingham.
Buenos días a todos y
Good morning.
todas. Un
Good
saludo muy
morning, everyone.
especial al
A
viceministro de
very
Salud
special
Pública
greeting
del
to the
Perú,
Vice
Dr.
Minister of Public Health of
Leonardo
Peru,
Rojas, al
Dr.
director general
Leonardo
de CDC
Rojas,
Perú, Dr.
the
César
Director
Munaico,
General of CDC Peru,
otros
Cesar
colegas de
Munaico,
MINSA Perú,
and
nuestros
other
colegas de la
colleagues of
OPS
MINSA
OMS,
Peru, our colleagues
Sebastián García
of PAHO
Saizo,
and
Adrián
WHO,
Cox,
Sebastián Garcia
Oscar
Saizo,
Mujica,
Adrian Cox,
Daniel
Oscar
Antiporta,
Mujica,
de las
Daniel
oficinas de país de
Antiporta,
la OPS
and from the
OMS,
country offices
al
of
doctor
PAHO and
Aloisio
WHO,
Barros,
Dr.
experto de Brasil y ponente en
Aloisio
este
Barros, expert
seminario,
from
a
Brazil and
todos los
speaker in this
expertos
seminar,
internacionales,
and
socios
all
y
the
estratégicos,
international experts and
representantes de la
strategic
academia
partners that
y
are
ministerios de
representatives
salud.
of
Su
academia
presencia
and
y
ministries of health.
participación es muy
Your
valorada.
presence and participation is
Y es
very
un honor
valuable.
para la OPS
And
OMS
it's
en
an
Perú
honor
acompañarlos en
for
este
PAHO and
importante
WHO in Peru
lanzamiento.
to be here with you in this
Hoy,
important
la
launch
región de las Américas
today. The
da un
region
paso
of the
más y
Americas gives
crucial
one
hacia la
more
equidad en
crucial
salud.
step towards health
Ese
equality.
esfuerzo conjunto
This joint
refleja nuestro
effort
compromiso
reflects
colectivo
our
por la
collective
salud
commitment
universal y
towards universal healthcare
fundamentalmente con la
and
reducción de las brechas
fundamentally
que
with a
castigan a
reduction
las
of the
poblaciones en
gaps that
situaciones de más
punish the
vulnerabilidad.
populations in more vulnerable
El
situations.
cuantificador de desigualdades
The
en salud
quantifier of
no es
health
simplemente
inequality
una
is not
herramienta
just
técnica,
a technical
es un
tool,
instrumento estratégico
it's
que
a
nos
strategic
permitirá
instrument
tres cosas.
that will
Uno,
allow us
es
three things.
fortalecer
One,
las capacidades
to
institucionales
strengthen the
para el
institutional
monitoreo
capacities
preciso de
for precise
desigualdades.
monitoring of
Dos,
inequalities.
es
Two,
informar y sustentar
informing
políticas
and
públicas basadas
supporting
en la
public
evidencia.
policies that
Y
is
tres,
based in evidence.
promover un
And three,
diálogo
promoting
intersectorial
an
efectivo sobre
intersectoral dialogue that
determinantes
is
sociales
effective
de la salud.
on the social determinants of health.
Como solemos recordar en la
As we
OPS-OMS,
tend to
lo
remind
que no
everyone
se
at PAHO and
mide
WHO,
no se
what is
puede
not
mejorar.
measured cannot be
Esta
improved.
plataforma
This
nos
platform
dota de la capacidad para
gives us the
transformar
capacity
datos
to
en
transform
decisiones y
data
a esas
into
decisiones
decisions,
en
and those
acciones
decisions
concretas que
into
cambian
concrete
vidas.
actions that can
La
change
equidad en
lives.
salud es un desafío compartido
Health
que
equality is
requiere
a
una
shared
respuesta
challenge that
regional
requires a
unificada.
regional
Por
unified
ello,
response.
la cooperación técnica
Therefore, the technical
adentro de los países,
cooperation
pero entre los
within the
países y
countries,
el
but
intercambio
also
de
among the
experiencias
countries,
son
and the exchange
esenciales.
in experiences are
Este
essential.
lanzamiento es una
This launch
reafirmación de que
is
la
a way to
integración
reaffirm
regional
that
es
regional
clave para
reintegration
enfrentar
is
estas
key
desigualdades.
to face these inequalities.
Nuestra premisa
Our
es medir
premise
para transformar.
is to measure
En este
to
camino quiero
transform.
destacar el liderazgo
In this
proactivo
journey, I want to
del
highlight
Ministerio
the
de Salud
proactive
de
leadership of the
Perú
Ministry of
en la
Health
adopción
of Peru
e
in the
impulso
adoption
de herramientas innovadoras como
of
eso.
tools that help
Gracias
us out like
al
this one.
esfuerzo sostenido del
Thanks
CDC
to
Perú
the sustained effort of the
en estrecha
CDC Peru
colaboración con la
in tight
OPS-OMS,
collaboration
este
with PAHO and
cuantificador se
WHO.
consolida como
This
parte
quantifier is
del
consolidated
ecosistema de
as part of
herramientas
an ecosystem
diseñado
of tools
para medir,
designed to
analizar,
measure,
actuar y transformar
analyze,
datos
act,
en
and
políticas
transform
públicas
data
efectivas.
into public policy
De
that is
hecho,
effective.
esta
In
colaboración
fact,
es un
this
ejemplo
collaboration
potente
is
de
a
cómo
powerful
la inteligencia
example of
sanitaria
how
puede convertirse
healthcare
en acción
intelligence can
concreta para
become a
mejorar la vida
concrete
de
action
las
to
personas.
improve the lives of
Por lo
people.
tanto, hacemos una
Therefore,
invitación a todos los
we
países aquí
invite
presentes
all the
a que
countries present
incorporen
here
esta
to
herramienta en su
incorporate this
sistema de
tool
información y
into
planificación.
their information and planning
Es el
system.
momento de convertir la evidencia en
It's
acción
the
a
moment to turn
escala
evidence
regional.
into action at a regional
Agradezco
scale.
la participación de cada uno de
I am
ustedes
thankful for the
y
participation
reafirmo
of each
el
one of you, and I
compromiso de la
reaffirm the
OPS-OMS
commitment
con la
of PAHO
equidad
and
y la salud
WHO
universal.
to
Sigamos
universal
trabajando para que
health
la salud
equality.
sea un derecho
Let's keep
fundamental
working for health
y
to
no
be a
privilegio,
fundamental right and not a
garantizando que nadie
privilege,
se quede atrás.
guaranteeing that nobody is
La
left behind.
equidad no es un idea
Equality is
distante,
not
es una
a distant
responsabilidad
ideal.
compartida.
It's a
Muchas
joint
gracias y que sea
responsibility. Thank you so
una
much.
jornada muy
And may this be a
fructífera.
very
Muchas gracias.
fruitful session. Thank you so much.
Thank you very much, Dr. Maureen Birmingham. Also, thank you, Dr. Mezzorina, for these important words of collaboration. Maureen, we couldn't see you, but we could hear the wonderful words that you said. Great. And I hope everyone can hear and see. If you can't, please put a note in the chat or in the Q&A for everyone. Now I would like to invite Dr. Oscar Majica, who is the assessor principal in this project. He is the social epidemiological advisor within the Unit for Health Analysis and Equity Metrics. This work represents work from many of the team members. I particularly want to note Dr. Antonio Sanhuesa as well. So Dr. Mujica will go through the context of the technical cooperation, and then we'll go into a presentation of the tool. Please, Dr. Mujica.
Muchas gracias, Adrian. Muy
Thank you so
buenos
much,
días a todos y a
Adrian.
todas. Un saludo
Good morning, everyone.
fraternal y solidario
Fraternal
a
and solidary
nuestros
greetings to
invitados y
all,
autoridades. Un
and
placer
to our
tenerlos aquí
guests
y a
and the
todos los
authorities.
participantes que ya casi
It's a
están
pleasure to
llegando a los
have you here, and
300
all
en este
participants
momento.
who it's
Es un
almost
momento,
300
como se
now
ha
at
dicho
this
aquí,
point.
como la doctora
It's
Birmingham,
a
muy
moment, as
especial
Dr. Birmingham said, that
y
is
que nos
very
convoca
special,
por el
which
lanzamiento
brings us
de
together
la
here because of
calculadora
the
del
launch
cuantificador de
of
desigualdades en
the
salud,
quantifier
además en un
for health
ejercicio
inequality
de
metrics in an
cooperación
exercise of cooperation
muy fructífero con
that
el
is
CDC
very
de Perú
fruitful
y la
with the
Organización
CDC
Panamericana de
of
Salud.
Peru
Yo solo
and
tomaré unos
PAHO.
minutos para
I will
poner un
only
poco de
take a few
contexto o
minutes
historia, si quieren,
to
de la cooperación
give a little bit
técnica de
of
la OPS
context
en
of the
el
technical
tema de la medición,
cooperation
el
of
análisis y
PAHO
monitoreo de
on
desigualdades en
measurement,
salud,
analysis, and
muy,
monitoring of
muy
health
rápidamente, aunque
inequalities
no voy a
very
hablar muy
quickly,
rápido para los...
although I'm not going to speak that fast because of the interpreters.
Sorry, Oscar, you muted yourself.
Thank you so much, Alvicio. Me pueden escuchar ahora, ¿no?
Sí.
Ok. La OPS tiene más de 123 años
PAHO
y contando.
has over
Es la
100,
más
is
antigua del
over
mundo
123 years old
tiene
and
entre
counting.
sus
It's the
tres
oldest in the
objetivos
world.
misionales
And within
el
its three
primero,
missional
el
objectives, the
promover la
first
equidad en
one
salud.
is
El
promoting
primero.
health equality, the
Eso
first one.
desde el lado del departamento,
This
de la
from
unidad
the
de
point
análisis
of
de
view of
salud
the
que ha llevado
Department of
muchos
the
nombres
Health
en el
Analysis Unit
transcurso
that has had many names along
de
these
estos años,
100 and
pero siempre con
something
este
years,
core, con este
but
núcleo de
always with
análisis.
this core
Eso
of
se ha traducido
analysis.
en lo que
And
ustedes
this has
pueden
been
ver allí,
translated
en
into what you
la
can
intención
see.
por
So it's
fortalecer
the
las capacidades
intention
institucionales
to strengthen
para el
institutional
monitoreo de desigualdades en
capacities
salud, que
for
esencialmente
monitoring of health
se orientan a
inequalities,
lo que
which
también pueden ver ahí,
essentially is
a
guided,
documentar
or you
gradientes
can
de
also
salud, a
read to
identificar
documenting
patrones de
health
desigualdad en
gradients
salud
and identifying
socialmente determinados,
social or
a
health
evaluar los cambios en
inequality
el
patterns
tiempo
that are
en
socially
los
determined,
gradientes y en los
and
patrones de
evaluate
desigualdad,
changes in time in the gradients
sobre
and the
todo
patterns of
si
inequality.
pueden estar asociados a
Especially,
políticas e
they can be
intervenciones pro
associated
equidad
to
y a
policies and
generar
interventions that
incidencia
are pro
política en favor de
equity
la
and
equidad en salud.
generating a political
Em,
incidence in the favor of health
Promover la equidad en salud es
equality.
un compromiso y una
Promoting
prioridad de
health
larga data en
equality
la
is a
OPS.
commitment
Y acá,
and a
muy
priority that
rápidamente,
has been
ustedes pueden
longstanding
ver,
at PAHO. And here,
eh,
very quickly, you can
em,
see
no solo son frases, son comandos
not
clave de
just
nuestros
phrases, but
directores,
key
nuestros cuatro
commands
últimos
of our
directores,
directors.
porque
Or
el tema
that's
ha
for
tenido mucha
directors
presencia
because
desde
this
entonces.
has had a lot of
El
presence
doctor
since
Alain,
then.
alrededor del año 2000,
Dr. Alain
tienen un libro
in
precioso sobre sus
the year
discursos sobre la búsqueda de
2000
la
has
equidad.
a beautiful
Em,
speech on the
Plantea una
search
pregunta
for
fundamental, ¿no?
quality.
¿Cuál es el papel de
And there's a
organizaciones como la
fundamental
OPS
question. What's
en
the
la
role of
promoción y en la
organizations like
operacionalización
PAHO
del
in the
concepto de
promotion
equidad en
and
salud,
operationalization
especialmente
in
cuando
health
nuestra
equity,
capacidad para
especially
cambiar la
when our
ecología social es
capacity
limitada?
To
La
change
primera y más
social
importante
ecology
tarea
is
es promover
limited.
la
The first
recolección
and
de
most
datos, que es
important task
exactamente
is to
la
promote
tercera
data
recomendación
collection, which
general
is
de la
exactly the
Comisión de
third
Determinantes Sociales de la
general
Salud del
recommendation
2008.
of the
Vamos muy
Commission
bien.
of Health
Hay que promover
Determinants
la
in
recolección de
2008.
datos,
We have
hay
to
que comandar
promote
las evidencias.
data collection, we have
La
to
doctora
command
Rosas
the
también dijo
evidence.
que no
And
solamente tenemos que
Dr.
hacer talk the talk,
Russell
sino walk the
also
walk,
said
es
that we
decir,
didn't
actuar con
even have,
coherencia y
we didn't
compromiso,
just have to
y eso
do
implica
top the top,
hacer
but also
visibles
walk
las
the walk.
desigualdades.
And this means
La doctora
making
Etienne también nos
inequalities
ha hecho un
visible.
énfasis muy
Dr.
grande
Etienne
en no
also did a
poder
very
seguir
big
ciegos a la
emphasis
equidad.
on not being able
Y lo
to
más
keep going
importante para
is
el futuro
blinded to equity.
saludable
The
es
most
lograr la equidad
important
social, que
thing
es una
for a
forma de
healthy
decir con
future is
claridad
achieving
que las
social equity,
desigualdades
which
en
is a
salud
way
son
to say with
consecuencia
clarity
de
that
desigualdades
health
sociales. Hay que
inequalities are a
restituir la justicia
consequence
social
of social
para restituir
inequalities.
la justicia
We have to
social.
restitute
Y nuestro doctor
social
Barbosa, el
um,
actual director,
justice to
que le ha puesto
restitute
mucho
health
énfasis a este
justice. And
tema,
Dr. Barbosa, our current director, who
es
has
reconocer
done
que
a lot of
la
emphasis
equidad
on
es
this,
nuestro compás moral
to
para
recognize
la
that
realización
equality is
de
our
esa
moral
aspiración
compass
grande que es la salud universal.
for this
Eh,
large aspiration, which is universal health
tenemos
care.
dos frentes para la
We
cooperación
have
técnica.
we
Digamos que
have
el
two fronts
interno o
for
el
technical
corporativo, o sea,
cooperation.
comenzar
The
por casa.
internal or corporate one, which is
El
starting
monitoreo de
from
desigualdades
home,
en los planes de cooperación técnica.
monitoring of
Esencialmente,
equalities in
eso ha
technical
significado
cooperations.
desde hacer
Essentially, this has
explícita la
meant
equidad en las
from
políticas de
making
presupuesto de la
equality
organización
explicit
para hacer
in the
progresivo el presupuesto y
budget
concentrar los
policies of the
recursos de la
organization,
organización
for it to be
en
progressive
los
and to
estados
focus
miembros
the
que
resources
necesitan
of
más,
the
y
organization on the
también hacer
member states
explícito,
that
como
need
no lo ha
this
hecho
most,
todavía ninguna otra
and to make
agencia,
it explicit as no other
explícitos
agency has done,
indicadores, o mejor dicho,
to make
metas
explicit
cuantitativas de
indicators or
reducción
goals
de
that
las
are
desigualdades
quantitative for
en
reduction of
salud
inequalities
en los planes
in health.
estratégicos de la organización. Ya son
In the
3 ciclos de
strategic
6
plans of
años
the
en los que
organizations is
eso
already
está
3 6-year
siendo
cycles
explícito. Y nos
where this has been
medimos
explicit,
nuestra eficacia
and
en
we
cooperación en
measure
términos
our
de reducción de
efficacy in
desigualdad,
cooperation in
no
terms
solamente de
of reduction
mejoría,
of
de
inequality,
reducción
not just
de
improvement
enfermedades o de
and
mejoría
reduction
de
of
la
disease
esperanza de vida.
or
Y en el
the
frente,
life
digamos,
expectancy.
externo regional,
And
en la
in the
cooperación
external regional
técnica,
front,
en
in
la
technical
medición de desigualdades
cooperation,
y el
measurement of
monitoreo de
inequalities
desigualdades
and
está centrado en el
monitoring of
ejercicio de la
inequalities
primera función
is
esencial
focused
de la
on the
salud pública,
exercise of
que
the
es el
first
análisis de
essential
situación de
role of
salud.
public health, which is
Y en
the
términos más
analysis of the
prácticos,
health
según
situation, and
iniciativa
in
que
more
ya también
practical
tiene más de
terms,
25
based on
años
an
en la
initiative
organización,
that
que es la
is over
iniciativa de
25
datos
years
básicos en
of
salud,
age of the organization,
que
which is the
todos los
initiative of
países han
basic
adoptado
data in
y
health, that
adaptado,
all countries have adopted and
esencialmente es
adapted.
la desagregación
Essentially,
de
it's
datos
the disaggregation of
importantes para la
data
salud a
that are
nivel
important for health
subnacional, no solo de
at
mortalidad
subnational
y de
level, not
morbilidad,
just for
sino también de
mortality and
recursos,
morbidity,
acceso,
but
cobertura,
also resources, access,
indicadores
coverage,
demográficos e
in the
indicadores
demographic
socioeconómicos,
indicators and
determinantes sociales de la salud.
socioeconomic
Ese es el
indicators or
sustrato
social determinants of
fundamental
health.
que ha
This is the fundamental
orientado nuestro
substrate
trabajo
that has
con los
guided
países
our
para
work with
fortalecer
the
capacidades
countries to
institucionales para la
strengthen
medición y monitoreo de
institutional
desigualdades.
capacities
Hay países
for
que han
inequalities
avanzado, como
measurement
el
and
Perú,
monitoring.
como
There's
Brasil,
countries that
como
have advanced like
México, hay
Peru,
muchos
like
más que
Brazil, like
mencionar, Chile,
Mexico. There's
en
many others to be
Centroamérica, a
mentioned,
nivel
Chile and Central
municipal.
America.
Son datos
At
administrativos.
municipality level, these are
Pueden que
administrative
estén
data.
incompletos, pueden que sean
It can be that they're
imperfectos, pero esos son
incomplete,
los datos
that
más
they're
ricos con los
imperfect,
que
but
contamos
these
con
are the
gran
richest
esfuerzo de los
data that
países
we have.
y con eso
It's a
es
lot of
posible
effort in the countries, and
documentar
with this,
y
it's possible
monitorear
to
las
document
desigualdades sociales
and
en salud.
monitor social inequalities in health.
Hemos tenido iniciativas instrumentales
And
en el
we've
transcurso
had
de estos
instrumental
30 años, desde
initiatives
este
along these
programa de brecha
30
que salió con
years
el ministro de Salud de
since this GAPS
Argentina,
program that came out with the
el
Minister
programa
of
EPIDAD
Health in
con una
Argentina,
cooperación con
the
la
EPIDAD
Junta de
program with
Galicia,
a
que tiene
cooperation
incorporado módulos de desigualdades, unos
that has
análisis por
incorporated
unas
inequalities modules and some
herramientas en Excel,
analysis or tools
una,
in Excel.
primero esbozo de explorador de
A
equidad también,
first
y ahora
idea
tenemos
of
esta magnífica
exploring of
herramienta, pero
equity, and
espectacular,
now we have
muy
this
sólida,
wonderful tool that is
robusta, ya
spectacular,
la van a
very
ver, la
solid,
van a conocer,
robust. You will
muy
see it, you will
práctica,
get to know it.
muy
It's so
amigable,
practical, it's
que
so
debe
user-friendly
potenciar toda esta
that needs
capacidad
to boost this
de lo que
capacity
queremos, que es
of what we want,
institucionalizar
which
el
is
monitoreo de las desigualdades en
institutionalizing
salud en el ejercicio de la
monitoring
función
of health
esencial número uno,
inequalities in the
es decir,
exercise
tomarle el
of
pulso a las
assist.
desigualdades y a
It's
lo que hacemos o
taking
dejamos de hacer
inequalities
para restituir
and
la
what
equidad
we
de
do
salud.
and what we
Han
don't
salido
do
una
to
gran cantidad
restitute
de productos
health
analíticos,
equality.
aquí
There's
apenas
been a
unos
lot of
cuantos se está
analytical
mostrando, pero
products that
con
have
los
come up.
países, no para
Only
los
a few are
países,
being
con
shown,
los
but
equipos
with the countries countries,
nacionales
not
están
for the countries.
construyendo. Y
With
un
the national
ejemplo muy
teams,
claro,
they're being built, in a very
muy
clear
bonito,
example,
además, con mucho orgullo lo digo, es el trabajo
and
que
I
se
say
hace
this proudly,
en Perú
is the work
y
that is
con
done
los
in Peru
compañeros del CDC en Perú.
and with our colleagues from
Muchas
the
gracias.
CDC in
La equidad de
Peru.
salud
Thank you
es
so much.
verdaderamente el único
Health
objetivo
equity is
aceptable.
the only objective that is acceptable.
Thank you very much, Oscar, for putting this all into context and reminding us that this work didn't start today or yesterday, and it will not end tomorrow. This is ongoing work that we will continually expand on. And it's all to improve access to health and reduce inequalities in health as well. So this will help us to pinpoint things and get to those things. Now we want to get into the tool. I invite Dr. Cesar Munaico from the CDC Peru. He is the Director General, and Dr. Gabriela Soto, the Director of Health Intelligence at CDC Peru, to show us more about the tool and how it can be used. You have the floor. Thank you.
Muchas gracias, Adrián. Buenos días con todos.
Thank you, Adrian. Good morning, everyone.
Perú.
A kind greeting from Peru.
Dar algunas palabras antes de
I
invitar
would
a
like
doctora
to
Soto que
offer a
pueda
few
hablar sobre
remarks
la
before
herramienta.
inviting Dr. Soto to be able to talk
El
about the
país
tool.
desde antes de la pandemia,
The
desde
country, since
2018,
before
ya
the
venimos
pandemic
trabajando,
and since
dando
2018, we've
un
been
cambio
working,
en la mirada a la salud.
giving a change in the view
Empezamos
towards
con
health.
apoyar
We
la
start
política
by
Perú
supporting
País Saludable, una política
the
multisectorial
policy
con
that is
enfoque
called
de
Perú
diferentes
País
sociales y
Saludable. It's
también de
multi-sectoral
cierre de brechas de
and
desigualdades.
also looking towards
Luego
closing gaps of
iniciamos un
inequalities.
trabajo fuerte en
And then
desarrollar
we started a strong
competencias a
work to
nivel de las
develop
regiones, así como
competencies
también
at regional level,
poder
as
generar
well as
instrumentos.
also being
Y
able to
esta
generate
calculadora es
instruments.
un instrumento
And this
importante que se
calculator
ha ido
is an important instrument
desarrollando
that
en la
has
unidad de
been
inteligencia
developed
sanitaria
at
del
the
Centro
health
Nacional de Epidemiología.
unit
Pero ahora estamos también
of our
abocados
epidemiology center.
a
But
poder
now
generar cambios
we're also
importantes.
looking towards trying to
Y esos
generate
cambios se tienen que
important
dar bajo el
changes.
enfoque de
And these
determinantes
changes
sociales.
have to
Tenemos
happen under the
varias
focus of
iniciativas.
social
Una iniciativa
determinants. We
muy
have several
importante es el
initiatives.
trabajo que venimos
A very
haciendo en la
important
región
initiative is
Loreto
what we've been doing
para abordar el
at the
tema
region
de
of Loreto
parasitosis y
to
anemia, pero de
address
un enfoque de determinantes sociales.
parasitosis and anemia, but with
Justo
a
el día
focus of
de
social
mañana voy a viajar a
determinants.
esta región
And
porque vamos a
tomorrow I
reunirnos
will
con los
be
alcaldes y
traveling
las
to this region
autoridades para
because we're going
empezar
to be meeting with
a
the
definir
mayors
acciones
and
en
the authorities
este
to be able
marco.
to start
Entonces,
defining
yo creo
actions
que el
within this
CDC está
framework.
contribuyendo
I
de manera
believe that
importante
the
a
CDC
poder
is
cambiar un
contributing
poco la
importantly
filosofía de trabajo
to be
aquí en
able to
Perú
exchange the
y
working
esta
philosophy here
herramienta
in
y
Peru.
las otras
And
herramientas
this
que se van a ir
tool
desarrollando
and
a
the
lo
other tools
largo
that will
de
be developed along
este año
this
y el siguiente año van a permitir
this
consolidar
year,
este
the next
trabajo a
year,
nivel
will
de
allow
las regiones, a
consolidating
nivel
this
local.
work at regional
Hemos
level
contribuido
and
también a
local
definir las
level.
prioridades de salud a
We've
nivel
contributed to
nacional, así como
defining
ahora a
health
nivel local y
priorities
regional,
and
considerando
nationally and as
prioridades que
well as
tengan un
locally
enfoque
and
determinantes
regionally.
sociales.
And
Así como también estamos
we are
trabajando
focusing on social
arduamente para que
determinants.
nuestros programas de
We're also
formación,
working
nuestros
very strong
graduados
so
del
that our
programa
training
FTP,
program
del
and our
perfil de primero
graduates
y
from
tres
our
en programa,
FTP
también
program
tengan este enfoque.
can
Yo creo
also
que
have
todavía
this
hay mucho por
focus.
hacer,
And I
pero
think there's a lot to be done yet.
herramienta es importante porque
But this tool is
va a
important
ayudar
because
a las
it will help
personas, ¿no? Que, con una herramienta muy
people.
sencilla para que puedan
It's a very
usar,
simple tool
analizar los datos y
to be able to
monitorizar
analyze
las
data and
desigualdades en sus
monitor
países. Yo creo que ese es un
inequalities in
aporte
their own
importante que
countries. And I think this
este
is an
trabajo
important
colaborativo con la
contribution
OPS ha
that this
logrado
collaborative work with PAHO has
y
achieved.
esperamos pues seguir colaborando
And we
y
hope to keep
aportando a la salud
collaborating and
pública de la
contributing
región de
to
las
public
Américas.
health in
Muchas
the
gracias,
region of the
doctora
Americas.
Soto,
Thank you
adelante.
so much, Dr. Soto. The floor is yours.
Muy buenos días con todos.
Good
Muchas
morning,
gracias.
everyone.
Creo que
Thank
me
you
uno
so
al saludo
much.
de nuestro
I
viceministro y
want
del
to
director
second the greeting
general,
of our
el doctor
Vice Minister and the
César
Director
Munaico.
General,
Estamos muy contentos de
Dr.
poder
Cesar
compartir con
Monaico. We're so
ustedes
happy to be able to
y
share with you
presentarles un poco la
and to
herramienta que es
present
motivo de este
the
seminario
tool,
virtual,
which is the
el
reason for
cuantificador
this
de
online
desigualdades en
seminar,
salud.
the quantifier of health inequalities.
Bien, previo a poder presentarles la
So
herramienta,
before
creo que queremos
presenting
contarles
the
un
tool,
poco que el
I
trabajo
think we
del
want to
enfoque de
tell
esta
you a little bit that the
herramienta
work and the
se
focus of
da
this tool
porque en el país ya venimos
happens
trabajando
because
la
in the
iniciativa
country
de poder
we've already
implementar
been
el monitoreo de
working
las
on the initiative
desigualdades
of
en salud.
implementing health
Este
inequality monitoring, and
marco de
this
trabajo se desarrolla en el contexto
framework is
de
developed
lo
within
que
the
es el marco
context
conceptual de los
of the
determinantes
conceptual
sociales de la
framework
salud.
of social
La
determinants of
medición de las
health, and
desigualdades
the measurement of
se
inequalities
fundamenta en el
is
modelo de los
based
determinantes sociales de la
on the
salud
model
de
of
la
social
OMS y
determinants of
OPS,
health of
este
PAHO
marco
and
reconoce que
WHO,
la salud
and this
no
framework
se distribuye
recognizes that
aleatoriamente,
health
sino que
is
sigue un
not randomly
gradiente social
distributed, but that it
determinado
follows a
por la posición que
determined
ocupan
social
las personas
gradient
en
due to
esta
the
jerarquía
position
social.
that people have in this social
También hemos
hierarchy.
tomado en cuenta el marco de
We've also
monitoreo de las
considered the framework
desigualdades
for
de salud en los
monitoring
documentos
of health
técnicos tanto de la
inequalities
OMS
in
y
the
de la
technical
OPS para el
documents both
desarrollo de esta
of PAHO
importante
and
herramienta,
WHO
¿no?
for the
Como ya lo
development of
mencionó
such an
nuestro
important tool, and as
director general,
our
nosotros venimos trabajando un poco
Director
el
General already
contexto
mentioned,
de
we've
este
been working a
monitoreo
bit
en
on the
el marco de la
context
política
of this
nacional
monitoring
multisectorial de
within the
salud que
framework of the
tenemos en el
National
país, que fue
Multisectoral
aprobada en
Policy of Health
agosto del
that we have in the
2020,
country, which was
y del
approved
plan
in August
estratégico
2020,
que nos
and the
ayuda a
strategic
implementar esta
plan
política
that
en
it
el
helps
país, que
us
fue
implement
aprobado
this
en junio del
policy in the country, which was
2021,
approved in June
que genera tres
2021,
ejes
which
de
generates
trabajo, ¿no?
three
De
axes of
gestión de
work:
determinantes, gestión
the
multisectorial y
determinants,
gestión de
management, multisectoral management,
territorial local, ¿no?
and local territorial
También comentarles que
management.
desde el año
I also
pasado,
wanted to tell you
en
that
marzo
starting
del
last year,
2024, el
in
país
March
aprobó las
2024,
prioridades
the country
nacionales de salud
approved the national
para los
priorities
siguientes
of
6
health
años.
for the
Y lo
next 6
particular de este
years.
proceso
And what's
es
specific
que
about this
trabajamos no
process is
solamente un
that
enfoque de
we work not
priorizar
only
enfermedades y
on a
daños,
focus of
sino también de
prioritizing
incluir dentro de la
diseases, but
priorización
also
todo lo que es
including
el
within the
contexto
prioritization
de
everything
condiciones de
related
vida y
to the
trabajo, servicios
context
de
of life
salud que están
conditions and
vinculados a lo que
work
son los
and health
determinantes sociales de
services and
salud.
everything
En
related to
este
social
marco, como
determinants
ya
of
lo
health.
comentó
And within this
el
framework,
doctor
as
Munaico,
Dr.
más o
Munaico
menos
already
desde previo a la
mentioned,
pandemia, pero yo le quiero
since
listar un
before the
poco algunas
pandemic,
actividades
but
que hemos
I
tenido
want
que
to
son
list a
previas
few
al
activities
desarrollo de
that
esta
we've had
actividad, que
that were
desde el
before
Centro
this
Nacional
activity,
Epidemiología,
that from the
Prevención y
National
Control de Enfermedades en el
Epidemiology
Perú
Center and
venimos
Prevention and Control of
promoviendo,
Diseases
¿no?
in Peru, we've been promoting.
Principalmente trabajamos bastante en la revisión del
Mainly, we
marco
work a
conceptual,
lot on the review of the
identificar
conceptual framework,
indicadores, ver las
identifying
metodologías de
indicators, and
cálculo. Ya en el
seeing the
2023
calculation
desarrollamos
methodologies. And in
una propuesta
2023,
de
we developed
calculadora también
a
offline
calculator proposal,
que nos
also
permita
offline,
trabajar
that
este
allows us
análisis
to
con datos
work
del país.
on this analysis
Empezamos a
with
ver un
data from
poco
the
el enfoque de
country, and we started to
priorizar
seeing
indicadores y estratificadores
the
de
focus on
salud. Ya en el
prioritizing indicators and
2024
stratifiers of
empezamos a
health. And in
desarrollar una
2024, we
plataforma
started
web
developing
que
a web
permita
platform
visibilizar
that
los
allows
resultados del análisis
visualizing
de
the
desigualdad
results
con un
of
enfoque
the inequality analysis with a focus
de identificar y priorizar los
on
indicadores del
identifying and
ODC3 y
prioritizing
también
the
aquellos relacionados a políticas y
OC3
prioridades
indicators,
nacionales,
and
¿no?
also those related to
Aquí
national
vimos
policies
un trabajo
and
cercano con
priorities.
el
And here
tema
we
de las
had
áreas de planificación en salud,
close work with the
con
health
el tema de
planning
abogacía
areas
multisectorial.
and with
Y ya en el
multi-sectoral
2025,
incidents.
donde tenemos
And
una
in
plataforma web
2025,
más
when we
amigable
have
referida al
a
monitoreo de
friendlier
desigualdades, es
web
donde nosotros
platform
trabajamos
for
y
inequality
empezamos
monitoring, is where we
este
work, and
desarrollo
we
conjunto para
started
tener una
with this
herramienta
joint developing to be
web que
able
nos
to have
permita
a
la
tool, a
medición
web tool that
de las
allows us
desigualdades en base a
to
datos
measure
externos.
inequalities based on
En
external
este
data.
contexto, como les
In this
comentamos, lo
context, as I
primero que
was telling
lanzamos fue el
you, the
Observatorio de los
first thing that we
Determinantes y
launched was the
Desigualdades
Observatory of the
en
Determinants
Salud.
of Inequalities
Tenemos
of
en la web
Health.
del CDC
We
este
have in the web
observatorio,
of the
donde se han
CDC
priorizado
this
mostrar
observatory where
el
we
análisis de los
prioritized
indicadores
showing the
priorizados
analysis
del
of
ODS3. Ahí
indicators,
tenemos razón de
prioritized
mortalidad
indicators of
materna, los de niños y todos los que están
SDG3,
priorizados.
maternal
Y
mortality, children
este
mortality, and everything that's
observatorio tiene
prioritized.
un
And
enfoque
this
que parte un
observatory
poco
has
para
a
poder
focus
trabajar la
that
herramienta, ¿no?
starts a little
Porque
bit to
así
be
como
able
aquí en el
to
observatorio
work on
también
the tool, because
pretendíamos
just as in
mostrar
the
los
observatory
datos
we
o
were
la evidencia de
intending to show
desigualdades,
the
nos
data or the
enfocamos
evidence
en
of
que esto
inequality,
también
we
tuviera
focus on the fact that this
una
also had
fácil interpretación de datos y
an
uso, ¿no? Que
easy
pueda
interpretation
no
and
solamente
use of
mostrar los
data,
datos, sino
to not
presentar
just be able to
una breve
show data, but
explicación
also present a
de
brief
lo que significan
explanation
estos datos, ¿no?
on
Entonces,
what
en
this
base a esta
data
herramienta
means.
es
So based
que
on this tool
empezamos a trabajar
that we
el
started
cuantificador de
working,
desigualdades en salud, ¿no? La
we started
idea
working
de
on
este
the
trabajo es
calculator
que en todo lo que
of
previamente
health
habíamos
inequalities. And the
desarrollado,
idea is
incluso en
that
las
everything that had been developed
herramientas
before,
que ya
even in the
existían, que la
tools
misma
that
OPS
already
promovía,
existed, that
identificamos
PAHO
algunas
was promoting,
oportunidades de mejora
we
en estas
identified a
herramientas, ¿no?
few improvement
Principalmente,
opportunities.
por ejemplo, la
And
organización y la
mainly,
gestión para los
the
datos no era muy
organization and
amigable.
management for data
Teníamos
wasn't
algunas
very friendly. We had
dificultades
some
ahí que no
difficulties there
necesariamente
that
hacían o invitaban a que el
didn't
personal pueda
necessarily
desarrollar este tipo
invite
de análisis.
for people to
Y
be
una
able
vez
to
que
develop these types of analysis.
las
And
herramientas
once
mostraban los
the
resultados,
tools
quedábamos un
showed
poco
the
cortos a
results,
poder
we were
utilizarlos
falling
o
short to be able
interpretarlos
to use
de
them
las
or
maneras
interpret them
correctas, ¿no?
in the
Esto porque
correct
nosotros
ways.
necesitábamos
This because
promover
we needed
el
to
desarrollo de
promote
este tipo de análisis a un
the
nivel más
development of this
subnacional y
type of analysis
necesitamos
to a more
implementar
subnational level,
herramientas
and we
amigables
needed to
y
implement tools that
que
were
puedan ser
friendly
utilizadas
and that
fácilmente
could
en
be
los niveles
used
subnacionales del país,
easily
¿no?
at
En este
subnational
contexto es que
levels of the
justo
country.
establecemos una cooperación
In this
técnica
context, we
entre el
established
Ministerio
a
de Salud de
technical
Perú y la
cooperation between
Organización
the
Panamericana de
Ministry of
Salud,
Health of Peru
y la
and
idea
PAHO,
era que esta herramienta permita
and the
promover la
idea was
medición
for
y el
the tool to
monitoreo de
be
las
able to allow
desigualdades en
promoting
salud
measurement and monitoring of health inequalities
que nos permita para que
that would allow
los
us
tomadores de decisiones puedan identificar
for
toda la
decision
información
that would
de
allow
patrones
decision makers
sistemáticos de
to be able to
desfavorecimiento,
identify systematic
tener
patterns and
insumos para evaluar el
to be able to
impacto
have input to
distributivo de las
assess
políticas
the
públicas
distributive impact of
y
public
tener
policies
información que nos
and to be
permita
able to
pasar de
have
un enfoque que es
information
el
that would
tradicional,
allow
donde nosotros
going from
vemos
a
o
focus which
manejamos
is the
tendencias,
traditional one
promedios,
where
a
we
uno de
see or
gradientes,
handle
¿no?
average
Esto
trends or one
necesario para
based on
la
gradients.
universalidad
This is
real de la salud.
necessary for the
Bien,
real
en este contexto es que
universality of health.
desarrollamos
And in this
esta
context is
herramienta.
where we
Cuando ustedes
develop this
ingresen a la
tool.
página web de la
When you
herramienta
go
van a
into the web
encontrar
page of the tool, you
esta
will
primera
find
imagen. La
this
idea es
first
que esta
image,
parte de
and the
aquí
idea is
simplemente
for this part here
permite
to
en
be
3
able
pasos
to just
poder
allow in
calcular o
3
tener
steps to
resultados
calculate
del análisis de
or
desigualdad
have
que ustedes
results
quieran
of
trabajar.
the inequality analysis that
La
you would like to
herramienta
work
también
on.
tiene unas bases
The
de
tool
prueba
also
en esta
has
sección que ustedes
some
pueden
test
descargar las
bases in
bases
this
y
section
probar
that
la
where you can
herramienta
download them
y también conocer un
and
poco la estructura de los
test out
datos,
the
¿no?
tool and also learn about the structure
Tiene
of
una
the
carga
data.
de datos simple e
It has
intuitiva.
a intuitive,
Es
simple
compatible y
data
flexible
uploading.
con los formatos de datos ya
It's compatible and
tanto de manera
flexible
vertical u
with
horizontal.
formats both vertically and
No
horizontally.
necesitan ustedes manipular los
You
datos
don't
para poder
need to
utilizar
manipulate
la
data to be able
calculadora,
to
incluso si es
use
que van a hacer
the
un análisis
calculator.
solamente de
And
un
even if you're
periodo
going
o
to do an
de un área
analysis
geográfica
of a
de sus
period
datos,
or a
esta
geographic
herramienta les
area,
va a permitir
this
poder
tool will
dentro de la
allow us
herramienta
to
utilizar
be able,
filtros que
within the
puedan
tool, to
ayudarlos a
use
complementar
filters
este
that can
análisis, ¿no?
help
Bueno,
complement
una
this
vez que ustedes cargan
analysis.
la
And
base,
once you
podemos
upload the
pasar a la parte
database,
de
we
configurar
can go to
o la carga y gestión
setting
de
up
datos. Una vez descargada los
either
datos,
the
ustedes
uploading and
pueden decir
management of
que esta
data.
base es de tipo
And
vertical
once it has
u
been uploaded, you
horizontal.
can say that it's vertical or
También les da
horizontal.
métodos
And it
específicos
also
según la
gives you
disponibilidad de
specific
información.
methods based
Si
on
ustedes
information
cuentan con
availability.
una base que
If
tenga
you
desagregado el
have
numerador o el
a base that
denominador
has
o
the
ya el
numerator,
indicador
denominator
calculado, pueden
disaggregated,
hacer esa
or the
selección para que les
indicator
permita
calculated, you can make the
modificar de esta
selection so that it
manera.
allows
Hay una selección
modifying this
automatizada
way.
de
There's
variables desde la
an
base de
automated
datos.
selection of variables from
No
the
necesariamente
database,
requiere un procesamiento
and it
previo
not
ni
necessarily
preparación
requires a
manual de la base,
previous
¿no?
processing
Aquí
or a
usted ya
manual
puede
preparation of the
manipular la
base.
información.
Here, you can manipulate the
Otros
information.
parámetros que necesitamos
Other
precisar, por
parameters
ejemplo,
that
si
we
el
need,
tipo de
for
indicador de
example,
salud
if
es
the
una
type
tasa o
of health
una
indicator
proporción, tasa o
is
razón,
a
o es una proporción, esto
rate
con el
or a
fin de ajustar
proportion,
la
this
metodología
with
para
the
cada
purpose of
uno de manera
adjusting the
automatizada.
methodology for each one in an automated manner.
Y lo otro
And
es que hay
the other
uso
thing
de
is that
diseño
there
para
is
una
a use
una
of a
interacción
design
intuitiva y eficiente,
for
¿no?
an intuitive and
Ahora, si es que
efficient
por ahora no se entiende
interaction.
alguna descripción técnica que se ha puesto
If for
aquí,
now we don't
toda la
understand any of the
sección de la
technical
calculadora
distributions that have been
tiene
done here,
estos
well,
iconos
the
de
section of the
ayuda que
calculator
ustedes al
has these
hacerle
icons for help
clic les va a dar una
where you can click
descripción,
and
mensajes
it
de
will
ayuda
give you
claros e
a
indicativos, o
description,
sea, incluso con algunos
clear
ejemplos de qué
messages that
significa
are
o cuándo
guiding,
utilizar,
even with
cuándo un
some
tipo de
examples of what this
estratificador
means
es
or how to
ascendente o
use, or
descendente, por
how
ejemplo,
some
y
sort
que
of
ustedes
stratifier
puedan
is top
tener
down or
mayor
bottom
claridad
up,
en el
and so
uso
you can have
de la
more
herramienta.
clarity in the use of the
Bueno,
tool.
después de haber seleccionado esa parte, nosotros
After having
ya
selected
podríamos
this
procesar
part,
los datos
we could
y
process the
tener acceso
data
a los resultados. Sin
and be
embargo,
able to have
la
access to
herramienta
results.
también tiene una
However,
sección de
the tool
configuración
also
avanzada.
has a section for advanced
Esto les
setup.
diseñado
This
específicamente para usuarios
designed
con mayor
specifically
experiencia en el
for
análisis de
users with
desigualdades.
greater
¿Por qué? Porque la
experience in the
herramienta ya
analysis
tiene
of
parámetros
inequalities.
preestablecidos
Why?
para la
Because the
mayoría de las
tool already
secciones.
has pre-established
Es
parameters for most of the sections, and this tool has incorporated predefined setups based on the most recommended methods for the analysis of inequality. Therefore, however, some people with more experience and with specific cases or with specific data structure can access to an advanced setup that offers a greater flexibility and methodological customization. And we'll see this briefly in the end, where you can filter some data or label them, and this will be shown in results and analysis. Now, once you process the data, the part of data presentation of the tool has four sections, and they all offer an interactive visualization with statistical detailed tables that we consider useful, explanation texts. And the four sections are a summary, and for descriptive analysis, and simple metrics, and complex metrics. And in general, the summary, we will be showing a summary of the graphics, of the inequality metrics, and another one is the interpretation guidelines. So based on the period that you have selected, we will change the interpretation automatically. So the idea is for these inputs to be able to not only have access to a tool that processes data that allows interpreting results. So in this section, we consider that it was important, and we sometimes consider that it's important to present the data of the inequality analysis, but not everybody knows a description of the health inequalities. It can be by trends per period or analysis, and this allows us to visualize the way that the health indicators presenting in a descriptive manner. And we can also do this for the equity stratifier. This is an important starting point for the inequality analysis. And in this session, we present graphs and tables and also explanatory text of what's being shown in the graphs. Now, when we talk about simple and complex matrices, the idea here is to show the results for simple metrics, for example, absolute gaps, relative gaps. They are supported today with data with confidence intervals, and the graphs and tables facilitate a visual and numerical interpretation, but also supported by automated explanatory texts. We also have several support tables that are more expanded that even show presentation per analysis unit or in time that you can use. Also for complex metrics, and this depending on what has been selected. So in this case, we're talking about metrics based on regressions and disproportionality for both cases. Structure is the same. We work presenting the graphs and the results and the values and tables and automated interpretation. Then finally, the tool integrates all the results for analysis, including the metrics of inequality in graphs and the complete interpretation guideline that can be exported into Word with a specific structure, and that also allows users to be able to modify the data that they consider. We can also download an Excel file that contains all detailed calculations, all of this in results. And it's about showing you this tool, and this has been the work of several months, even years actually, also with a focus to validate. And in Peru, we've tried to validate in 2 national technical meetings at subnational level the use of this tool with the subnational levels, and this has also helped to do this better and to improve certain things. And even though we consider that the tool is available
que pueda ayudar a mejorar
I'm sure that in the daily use,
la característica principal de
this
esta
will help us
herramienta, ¿no? Que la
improve the
idea es que
main
sea de fácil
characteristic of
uso
this
y que
tool.
podamos todos, cualquier
And
persona que
the
tenga conocimientos
idea is
básicos
for
en
it to
análisis
be easily
desigualdad, hasta una
used
persona
and
muy
for
experta
anybody
poder
to have
utilizarlo, ¿no?
basic knowledge, or
Bueno,
somebody
en este
who is an
contexto,
expert can actually use it.
queremos
So in this
comentarles que
context,
consideramos
we
que esta es
want to
una
comment that we
interfaz
consider that
amigable
this
para
is a
todo tipo de
user-friendly
usuarios con todo
interface
nivel
for
de
all types
experiencia, tanto
of users with
desde
all kinds of
tenga un
experience,
nivel básico
both
como un nivel
from
avanzado,
basic level as well as
que
advanced
convierte los
level,
datos en evidencia para
that
toma de
converts
decisiones.
data into
El
evidence
equipo de
for
trabajo
decision
en el que
making.
desarrolla
The
un poco
work
también
team that develops
considera que es una herramienta
this
diseñada
considers
para
that this
trabajar
is a
con
tool that is
datos, no
designed
para
to
luchar
work
con
with
ellos,
data and not to fight against
Esta
them.
herramienta ha sido revisada
This
en
tool has been reviewed
en varios
in
niveles y
several
también ha tenido
levels
varios tipos de validación
and has
y ha
had
sido
several types of
ampliada para estar
validation, and it
disponible en
has
los
been
4
expanded
idiomas
to
oficiales de la
be
OPS,
available in the
el
4
inglés,
official
el
languages of
español, el
PAHO:
francés y el portugués,
English,
con
Spanish,
el
French, and
objetivo de apoyar
Portuguese,
a todos
with
los
the
países y
objective of
territorios de las
supporting
Américas, facilitando
all the
así su
countries and
adopción y uso en los
territories of the
distintos
Americas,
contextos
facilitating
territoriales de la
the
región.
adoption and
Bueno,
use in the
está
entire region.
disponible la herramienta en el portal del CDC, del
The
Ministerio de
tool
Salud de
is
Perú. En este
available in
caso
the
solo
tool,
tenemos la
the
versión
CDC
en
portal of the
español
Ministry of
y
Health
la
in
idea
Peru.
del uso es
Right
para
now, we
poder
only
seguir
have the version
promoviendo
in
el
Spanish,
trabajo a
and the
nivel
idea is to keep
nacional en el
promoting
país con el
the work
desarrollo
at
de esta
national
herramienta
level in the
y
country with the
también
development of this tool.
está en el
And
portal del
also,
ODS-3 de la
it's in the
OPS. Allí sí
portal
está
of
disponible en los 4
ODS
idiomas. Aquí tenemos
SDG3,
el link, pero
and it's
igual
available in the 4
seguro que
languages.
vamos a
We have the
promoverles
link
por
here,
otros medios
but
también el
we're going
acceso.
to promote
En
them
ambos
through other
link pueden
means
acceder
of
a
this
este
access.
portal
And
y
you
hacer
can
uso de la
access to
herramienta.
this portal
Bueno,
and
antes
make
yo creo que
use of
de
the
poder
tool.
mostrarles
So
brevemente un
before
poco la
being
herramienta,
able
yo
to
quería
show you the
comentarles que si
tool,
bien es cierto esto ha
I
sido
wanted
un
to tell
trabajo
you that
interinstitucional entre el
even though this
Ministerio de
has been an
Salud de Perú
interinstitutional
y la
work
OPS,
between the
hay todo
Ministry
un
of Health of
equipo de
Peru and
trabajo
PAHO,
que ha
there's
estado
a huge work team that has
impulsando el
been
desarrollo de esta herramienta de
driving
parte del
the
CDC, como ya
development
lo
of these
comentamos.
tools,
Hemos
of
recibido
this
un
tool on part
apoyo
of the
íntegro
CDC.
del Viceministerio de
We've
Salud Pública
received
del país
a
para
lot of
poder no
support from the
solamente
Ministry of Public Health
desarrollar la
from
herramienta,
the
sino
country
también proceder a su
to be
validación.
able to develop
En todo este
the
proceso, los
tool
talleres también han
and the
sido organizados en
validation.
el
And in
marco de
this
un proyecto que
process,
estamos haciendo con el Banco
this
Mundial
is
y ha sido
being done
impulsado
in
por
the
el equipo
framework
técnico de la
of the
Unidad de Análisis de
process
Situación
of
de
the
Salud,
team,
en
of the
que
technical team
justo
for the
menciono que
analysis
actualmente
of
está
health
liderado por el doctor
situation.
Carlos
And
Martínez
it's
y
led
el doctor
currently
Aquiles
by
Vilches,
Dr.
quienes
Carlos
son los
Martinez and
equipos que han
Dr.
estado
Aquiles
promoviendo el
Vilches,
uso
the
y desarrollo
teams
de esta
that
herramienta, ¿no? De
have
parte
been
de la OPS,
promoting
en
the
realidad
use of
agradecer
this
al
tool.
Departamento de
And on
Evidencia,
behalf of
Inteligencia para la Acción
PAHO,
en
we want
Salud
to thank the
de la
evidence
OPS y a la
department,
sede
the Department of
de la
Evidence and Health,
Organización Panamericana de Salud en
PAHO,
Perú,
and
en
to
especial
the
a los
PAHO
asesores
branch
regionales,
in
el doctor
Peru,
Mujica, el doctor
and
Sangüesa y la
Dr.
doctora Talavera,
Mujica, Dr.
quienes han
Sangüesa, and
estado
Dr. Talavera,
constantemente
who
trabajando con
have been
nosotros,
constantly working with us
promoviendo esta herramienta.
in promoting this
Bien,
tool.
yo termino aquí la
I
presentación.
want to
Muchas
close
gracias.
here
En
this
realidad, les
presentation.
invitamos a
Thank you
conocer
so
nuestro
much,
país
and we
y también
invite
a
you to
visitar
get to
las
know our
páginas
country and to
del
visit
CDC, donde van a encontrar
the
toda la
web pages of
información
the
de esta
CDC, where you'll be able to
herramienta.
find
Y
all the
brevemente voy a
information
poder
in this tool,
mostrarles un
and very
poco
briefly I'll be
la
able to show
herramienta, el
you
uso
the tool, the use,
de la herramienta
the use of the tool
en vivo, ¿no? Bien,
live.
entiendo que sí se está viendo la herramienta.
I
Bueno,
understand that you're able
como
to
ya
see
les
the
había
tool.
mencionado,
Yes.
esta es la primera
So as I had mentioned, this is the
ventana que ustedes
first
van a ver. En esta sección
window you'll
hay
see
dos
in this
bases de datos,
section.
una en
There's two
formato vertical
databases,
y otra en
one
horizontal,
in
que ustedes
vertical
pueden
format and one in
descargar para poder
horizontal format that
utilizar
you can
la
download to
herramienta
be
o por
able
lo
to
menos
use the
probarla.
tool, or
Ustedes
at
una vez
least
que
test it
descarguen la
out.
base, buscan
And
dónde se ha
you
descargado la
download the
base, pueden
base, you search
seleccionarla
where
y
it's been downloaded,
automáticamente
you
la
can
base va a
select it,
cargarse
and then
y
it
de
will
ahí
be
se abre una
automatically
serie de opciones
uploaded.
para la
And
gestión
here there's a
de
series of
los datos.
options that are
En
opened up
primer lugar,
for data management. First of all,
ustedes pueden seleccionar qué tipo de
you
base
can
están
select what
utilizando,
types
vertical
of
o
databases
horizontal. En
you're
este caso
using,
es
vertical
vertical.
or horizontal. In
Les
this case,
permite
it's
también
vertical. This
poder
allows you
seleccionar qué
also to
tipo de
be able to
variar, si
select
su
what
base de
types
datos
of variables,
tiene
like if your database
el
has
desagregado de numerador y
the
denominador.
disaggregated
Cuando ustedes
numerator and
hacen ese
denominator.
cambio,
When
aquí
you
en la
do this
selección de variables
change
se cambia un
here in
poco
the
la
variable
estructura.
selection,
En este
the
caso
structure
para
changes a bit. in this
del
case,
ejemplo vamos a decir que no
for
y
effects of the example,
seleccionamos
we're
la
going to say
variable.
no,
En mi base
and we
la,
select the
la
variable.
variable
In
periodo
my
se llama
base,
año,
the
la unidad de análisis
period
está con el
variable is
nombre
called
state,
year.
el
The
indicador de
analysis
salud
unit,
es razón
here
de
we
muerte
have the health
materna,
indicator,
la
which is
población es
maternal
nacidos
mortality.
vivos y el
Population is
estratificador de salud
live births,
es,
and the stratifier, the
perdón, el
health
estratificador de
stratifier.
equidad es
Sorry,
necesidades básicas
the
insatisfechas.
equity stratifier is
Una vez que seleccionamos
unsatisfied
las
basic
variables,
needs.
pasamos
And
a la
once we
sección
select the
parámetros,
variables, we go
tanto de
to
los
the section that's
indicadores de
called
salud y de
parameters,
desigualdad.
both of health
Aquí en tipo
indicators
de
and
indicador es
inequality.
importante ver
Here in
qué
indicator
tipo
type, it's
de
important to
indicador, en este
see
caso es
what
tasa.
type of indicator. Here in this
Factores
case, it's
100,000
the rate.
pueden también,
The
de
factor
acuerdo
is 100,000,
al
and
tipo de
also,
indicador, seleccionar el
depending on the
tamaño
type of
con el que se está
indicator, you can
utilizando.
select the
Y en el
size that you're using.
estratificador de
And
equidad
in
es
the
importante
stratifier
ver
for
si es un
equality, it's
indicador tipo
important to see
ascendente o
if
descendente.
it's
Igual, si no
a
entiendo
top-down or
a qué se
bottom-up
refiere, podemos
indicator. So if I
abrir
don't
esta
understand what
sección
this
de
is
ayuda y
about,
decir es
we
sí
can open
cuando,
the
por
help
ejemplo, un
section
aumento
and
refleja
say,
una
for
mejor
example,
condición, y
when an
el
increase
ejemplo, el PBI,
shows
y es
a better
no cuando un
condition. Here's
aumento
an
refleja una
example.
peor condición. En este caso, el
It can be
ejemplo es
yes
NBI.
or no.
Nosotros estamos trabajando con NBI,
And
por lo
we're
tanto,
working with
cámbialo.
NBI.
Y aquí podríamos
So
simplemente
it changes
procesar
to
los
no.
datos, pero antes de
Here we
procesar,
could just process the information, but before
Discúlpame.
processing,
¿Pueden hablar más despacio, por favor, para la interpretación?
ok, gracias.
thank
En
you
la
so much.
configuración avanzada podemos aquí, por
In
ejemplo, si yo
advanced
quiero filtrar alguna
configuration,
variable, poder
if I want to
seleccionarlo. En
filter
este
a
caso no
variable, we
necesito
want to be
hacer
able to
ningún
select it.
filtro,
In this
así
case,
que no voy
I
a
don't need to do
seleccionar.
any kind of
En la
filter, so I'm
sección de
not going to
etiquetas puedo
select it.
cambiar los
In the
nombres,
tags
por ejemplo, razón de
section, I
muerte
can change the
materna,
names. For
ya no va a
example,
quedar como
the reason for
estratificador, en este
maternal
caso es de
mortality, it's not going to
necesidades
be a
básicas
stratifier.
insatisfechas, y
This
así
case, it's
puedo
unsatisfied
yo
basic needs, and
cambiar
there
las etiquetas
I
de
can
los demás
change the
valores, ¿no? De
labels
acuerdo, en
for
este
the
caso puedo
different
poner, por
values.
ejemplo,
And in this case,
departamento.
I can put, for example, the
Y si
department.
quiero hacer estos cambios, termino de
And
hacer
if I
los
want to
cambios.
make these changes, I finish
En la
making the
sección de
changes.
métricas de
In
desigualdad,
the section
por
of
defecto les va a
inequality
aparecer
matrix,
seleccionadas 4
metrics,
opciones, ¿no?
you
Que
will
me
have 4
muestren
options
tanto
selected by
las
default
métricas de brecha
that can show me
absoluta, relativa, el índice de
absolute and
desigualdad,
relative
la
gaps, the
pendiente y el índice de
inequality index,
concentración. Yo puedo
and the
quitar o
concentration
ampliar de
index. And
acuerdo
I
a la
can take
necesidad que yo
out or
requiera en mi
expand
análisis
depending
estos
on the
datos,
need
o
that I
dejarlo
require
de
in my
manera
analysis,
automatizada, ¿no?
or leave this in
En
an
la sección de
automated manner.
métricas simples,
In
como ya
simple
les había dicho, en
metrics,
realidad estas
as
dos
I had
secciones
mentioned in these two
están ya
sections,
predeterminadas
they are
de manera
predetermined
automatizada. Sin embargo,
in an
alguien que
automated
quiera hacer un
manner.
ajuste
However,
puede
somebody who wants to
utilizar y
do an
cambiar los
adjustment
modelos.
can
Y
use
si
and
por ahora
change
no
the
entiendo un poco
models.
a
And if
qué
I
término se refiere,
don't
en los
understand the
iconos de
terms that
ayuda se
refers to,
precisan
and the
incluso
help
a qué nos estamos
icons,
refiriendo con el término MAE, por ejemplo,
explains what we're referring to with the term my, for
y todos los
example,
términos que se trabajan
and all
dentro
the
de la
terms that
calculadora.
we use within
Igual
the
hay una
calculator.
sección tutorial
And
que
there's
me
also
permite
a
también
tutorial
conocer
section that
mayor
allows
detalle de
me
esta sección, ¿no?
to learn greater
Igual
details
para este
about this
tema
section. And
de las
also
otras métricas hay todo
for
un
the
tipo
other
de cálculo
metrics,
y una opción
there's
que podemos
a lot of
utilizar,
kinds
¿no?
of
Sin embargo,
calculations and an option that we can
si
use.
no necesito hacer ningún
However,
cambio,
if
no es
I don't
necesario que yo
need
haga
to
ninguna
make any changes,
modificación
it's
en
not
estas
necessary for
secciones,
me to make
simplemente le doy
any
procesar.
modification to the section, and I just click
Esperamos
on process,
un momento.
and we wait for a second.
Y ya como les había comentado, el apartado de resultados nos va a mostrar estas 4
And as I had
opciones.
commented,
En la sección resumen también por defecto
this will
les
show the
muestra un
two
periodo de
sections, and
3
in the
años,
summary sections,
pero
I'm
ustedes,
showing
la base que
you
hemos cargado tiene 5,
a 3-year
pero ustedes
period, and
pueden
the basis that we
seleccionar
had
si
shown
quieren
has
que se
5.
muestre 2 años, 1 año
And
o
you
los 3
can
años,
show
¿no? De
if you
acuerdo a
want
eso,
2
se
years,
muestra
1
la
year, or the 3
información.
years.
Les
And
había
based on this, we
mencionado
want to
que
show
la
the
primera parte
information.
es
I had
resumen de los
mentioned that the
gráficos,
first part
resumen de
is
las
the
métricas,
summary
y
of
la
the
parte de
graphs of the
guía de
metrics and
interpretación
the
nos permite un
interpretation
poco
guidelines
tener un
that allows
resumen de lo
us
que
to have
significa
a summary of what it
los
means,
resultados gráficos y en
what
tablas que les estamos
the
mostrando
graphs and
arriba.
table result
Y
mean.
si hay más años,
And
aquí les
if
permite
there's more
también
years, here
cambiar
this
esa
allows
selección
us
y
to change
automáticamente
this
va a cambiar,
selection,
¿no?
and then this
Igual
will
en
change
el
automatically.
apartado descriptivo
Now, in the descriptive section, all the graphs are interactive. You can activate or deactivate how you want the information to look. You can have it by terms. And we have the presentation of the equity stratifier. And there's also other summary tables. In the simple metrics section, it's a more expanded analysis. And we have here with relative and absolute gaps, we have two types of graphs, the gradients, which is a traditional one that we can see, or we can change to this other graph. And we also have tables that summarize the simple metrics. And there's help even on what we refer to when we talk about absolute gaps, when we talk about also relative gaps, and in the interpretation. Here we have what it means in other annex tables, and it shows us indicators and equity stratifiers, social group per analysis unit in this case, or these tables are metrics, these are summaries. We're going to have the same concept when we talk about complex matrix. It's the same scheme. We have two groups, and the graphs are interactive. If we don't want to see every year, we want to see every year, we can deactivate the information. And then finally, as I had said, all of these data can be downloaded into a Word format that you can easily modify based on your need. The format presents a summary of the methodology and the data and the graphs that can be useful, it can be easily edited. So maybe I've also wanted to very quickly be able to present a demonstration of the use of the tool. I know that you may all have access to it, and you can share your appreciations, and we are very happy to receive your comments and to improve this tool so that it can be used not only in our country, but also in the entire region of the Americas. And I close with this, and thank you so much.
Dr. Soto, for going through the tool with us, both in your presentation and both in the live tool. In the chat, you will see two links, one directly to the tool that Peru has, and another in OPS and PAHO with Shiny Apps that has also been expanded through collaboration with CDC Peru. It has been expanded based on interaction and feedback we have received from other people from other countries, and it will continue to be expanded. And the reason why we put it later in the presentation is because we have over 300 people, and we didn't want everyone at once in it, or it would have been complicated when Dr. Soto went into it. So please go in and use it. At this moment, I'd like to open the floor to Dr. Aloisio Barras, who is the Executive Director at the International Center for Equity at the Federal University of Pelotas in Brazil, and to Dr. Daniel Antiporta, who is the advisor in PAHO, Ecuador, and inequalities and equity metrics, to give a few comments. And we want to also leave enough time to answer a few things on the tool and a few questions that people will have. So thank you very much. You have the floor, Dr. Luis.
Okay. Am I on?
You are on, but you are a bit distant. If you could come closer to the mic or.
Okay, no, it's fine. It's because I'm still seeing you, Adrian, in the main screen, but it's fine.
Oh, let me
So,
turn.
I am, well, terribly happy and honored to participate in this launch. This is a terrific tool. You have just seen it working, and it is really, really useful. Before making more comments on the tool itself, I would like just to sort of take a step back and remind everyone why it is so important to work and explore health inequalities. So if we believe, and I think most of us do, that health is a human right, then each of us is entitled to enjoy the best health status possible. According to my country's constitution, offering this opportunity is the responsibility of the state. So it extends, I think, to all of us who work with health, public health, and so on, to work towards health equity. The thing is that our societies are structured and work in a way that it causes social stratifications and social groups that are exposed to health risks in very different ways, that have very different levels of vulnerability to these health risks, and ultimately suffer very different consequences from the, well, exposures and of illness. So here is where health inequalities start. And in most cases, these health inequalities are unfair, are avoidable, and this is what we call health inequities, because exactly they are unjust. And as public health workers, researchers, we are called to do something against it. And it's the role of public health policies to make these differences sort of less important, take into account these differences, to counteract the forces of our capitalist societies, to redress this balance and equalize health. So it's really important for us to do this, to know what's going on, to identify which groups are at a disadvantage, the size of these disadvantages, in which aspect of health they are disadvantaged. So that's key to know where the problems are. And for that, we need good quality data that will help us to expose these inequalities and motivate policymakers, managers, and the public in general. But to make the data speak, we need tools to calculate these indicators, to prepare visualizations. And these things must be clear, intuitive, so that health disparities are easy to grasp, even by non-technical people. And this is exactly where our health inequalities quantifier becomes so important. Because our countries in our region, are increasingly investing in routine data, in data collection in general, but especially routine data. And the quantifier makes the use of this data a breeze. The quantifier sort of especially designed towards routine data and towards looking at subnational differences and inequalities, so that we have a more granular picture of the indicators that interested us. So this is really a very easy and important tool. I was playing with it, and for me, the hardest step was preparing the data. And it's not difficult at all, because after you get your data right, you just click on a button and you have a comprehensive and at the same time intuitive set of indicators and graphs. And as you said, you just saw, you can sort of download a full report with all of these indicators, tables and graphs and so on. And so a report that is easy to understand, highly configurable as well. You can choose different approaches and different results. It's really, I think the strongest point of this tool is that it's easy to use. It doesn't require any sort of complex understanding of theory. And so you have complex measures of inequality, simple measures of inequality. So you can use whatever you need for your analysis, for your aims, immediate aims. I also was very happy to see equiplots in the reports. Our team sort of adopted, and actually started using the term equiplot for these dot graphs. And so it's very good to see them used here. I honestly believe that they are the best way to present inequalities. So the quantifier is a very useful tool. It automates the analysis process. It needs quality data, and routine data has problems, as we know. So under-reporting, over-reporting are common problems. Sometimes it's very hard to have a good quality denominator for the indicators we are interested in. So it's really important to evaluate the results and compare these results with other sources of information. And I think health surveys in this situation are really useful. And then here comes a bit of my advertising. Our center, the International Center for Equity in Health, just released a tool that allows people to download data from hundreds of national health surveys and choose from hundreds of health indicators. Our region is very well represented in this repository that we made available with 112 surveys from 27 different countries, starting back in 1991. So our data retriever is a very good partner to the quantifier so that you can download your health indicators of interest stratified by state or province, and then you can analyze it with the quantifier. I think it's a beautiful marriage of tools. So thank you very much for the opportunity. I hope my comments will increase the interest and the enthusiasm of people to use this tool. And congratulations to the whole team, because I think it will be incredibly useful, powerful and important. Thank you.
Thank you, Dr. Barras. And I know we are going slightly over time. If you can allow us a few more minutes for those of you who can stay. Daniel, if you could please give us your comments concisely. Thank you.
Claro, claro, Adrian, no te preocupes, seré breve. Primero, unarme a las felicitaciones
Yes,
al
of course.
equipo
First, I want to join in
regional de
congratulating
análisis de
the
salud
regional tool
métricas de la
in
OPS, pero
health
también al
analysis and
CES
metrics
Perú
of
por
PAHO,
esta herramienta tan
and
importante.
also the branches in Peru for
Creemos
this
que
important
esta herramienta, que
tool.
es de acceso libre,
And
constituye
we want this
un paso
tool, which
importante
is a
de
free
pasar,
access.
digamos,
We
del
know that it constitutes an
compromiso
important step
declarativo con la
for
equidad
going from a
hacia ya estar
commitment, iterative
analizando
commitment to
las
equality
inequidades
to
para tomar
start
acciones
to
informadas
analyze
con
inequalities, to
evidencia
make
para
informed
poder orientar
decisions that are
políticas públicas
evidence-based to
más
be able
justas
to
y
guide
efectivas.
public policy that is
Desde la
more
tecnología
just and
social
effective.
y, claro, alineados con
And this is also aligned to the social determinants of health. It's important to remind you that health inequalities this is a consequence of social and political situations that distribute resources unjustly and opportunities and the capacities to protect health. In this context, this tool is key. It's fundamental because it allows identifying and measuring gaps at territorial level that are a product of these inequalities. So a few key things of the tool. First, the analytical flexibility. It surprised me to be able to work with different types of databases and sources, to be able to work in specific questions and matters for different countries, and being able to use 6 different types of measures of inequality that not only allow to dimension gaps and also understand gradients and define this into a single number. And also territorial focus that allows visibilizing inequalities that at national average are not being able to be seen. This is important because this is based on public policy governance and excess of political power. This tool allows us to visualize these tools at territorial level, being a provincial department, because health governance in many countries in the region follow this logic. Third, clear orientation towards the technical teams of epidemiology and planning and monitoring to go from the description towards the systematic analysis of the inequity gaps. And this tool does not replace technical judgment. It just supports technical judgment with solid evidence. And 2 final points. This opens us doors not only to the ministries of health, but also to academia and civil society, because it can obtain data sources from all types in promoting transparency and accountability, and allows us to work in a coordinated manner to be able to attack the cause of the cause that are the social determinants of health. And then finally, I just want to maybe highlight the importance of this tool for the importance of the analysis of ASIS, which is a core of public health analysis. And I think that this dashboard of this quantifier constitutes an analytical infrastructure for health equality, and its relevance is not just a visualization of data that I think is very important, and also the quantitative measurement of a technical solid basis to transform the evidence that we have in guided decisions towards social justice. I want to thank you for this space and this tool to try to evolve not just measurement, but also the work in inequality in the region of the Americas. Thank you.
Gracias.
Thank you.
And thank you to everyone. We have some questions and answers. And the question and answer that have been answered, you can upload your own information. So it's only limited to that. It's not only what you saw in the presentation. What you saw that Dr. Soto put up was the data that she had herself. But the beauty of the tool is for you to use your own data and put up. One of the questions we also had was, can we share the data and what type of research would help improve the tool? What would help improve the tool is you using it with your own data and having your own questions. I also see in the chat that a few people have questions about uploading their own information, how to use the tool, as well as if they have questions, please reach out to us. We are happy to help and answer your questions. Likewise, I am sure all the colleagues on the team, I'd like to also thank Dr. Soto for recognizing all the colleagues on the team who had a lot of input into this. Please go to the tool. We have the links again in the chat. The tool that is on the PAHO page. There's also a tool that CDC has. The PAHO tool has been expanded and easier for everyone to use and will be in all languages, Spanish, English, Portuguese. So please go ahead and use that. If you have any other questions, please let us know. The recording will also be on the PAHO YouTube channel. where you'll be able to see it. And if there are any questions we haven't answered, we will get to that. At this time, I would like to invite Dr. Sebastian Garcia, the director of the Department of Evidence and Intelligence for Action and Health, for closing remarks. Thank you.
Muchas gracias, Adrian, y muchas gracias a todos los que participaron en este
Thank you
encuentro.
so much, Adrian, and thank you so much for everybody who participated in this meeting and everybody who was able to stay a few minutes after our closing time. Thank you so much for the interest. I just want to point out the importance of having this tool in our region today as a regional public good, a development that, as we could share today, starts with a priority and with a local team in Peru, the CDC, that we are deeply thankful for, but that advances and evolves and becomes a tool that we have available for the region of the Americas, and that we believe will be a very important piece to generate a community that allows not just to use the tool, but also to develop it beyond and incorporating modules and incorporating a regional perspective from each one of the points of view of our countries, and with this being able to collectively collaborate to the development of the measurement of health inequality in our region. I am very thankful for the to the deputy to the vice minister in Peru who was here with us today, and Dr. Rojas Mesarina and Dr. Munaico and Dr. Soto from the CDC Peru, who were directly involved in the development of this tool and who presented it today, and presented the advantages and how to use it in the context of the measurement of inequality. And of course, to the PAHO tool from PAHO team from our representative Dr. Birmingham and their team in Peru, and in the Department of Evidence and Intelligence for Action and Health that is making this possible today. To all of you, the invitation is to use the tool to make it be a part of the decision making in your day-to-day, and of course to collaborate for this development, not to be just a development in an immensity of problems, but in these developments that we can work on collectively. Thank you so much. Thank you, Adrian, for your moderation, and to the team that also made this webinar possible. To our interpreters, I see Dr. Talavera also connected. And Daniel, thank you so much for your comments and for supporting us in these initiatives. And to everyone, once more, I want to wish you a great year end, and we hope that next year will be a year full of opportunities and growth for our region, so that the region can benefit from our collective work and can already also help with the region's health improvement. Happy New Year and the best to all of you. Thanks so much. Thank you.
Muchas gracias.